Let's start our program with a loud salawat. Humma salli ala Muhammad wa ali Muhammad. Uh, Before we start our program, let me just give you a little background for the people who are new about Al-Sadiq Forum. I believe we are in our 12th year of our monthly meeting. Mashallah, we have been able to continue even during COVID. We continued with our program. Most of it was on Zoom, but mashallah, we kept it every month. Our program continued. Those of you who are not aware, please leave your phone number, email address so that we can inform you about the program. In our monthly program, we invite people from different disciplines. We have invited many doctors, accountants, people expert in other fields, literary people. We had book opening ceremonies. So we had people from Medicare, Medicaid to help people select proper plans. So there have been many programs here in different disciplines. Is there any program that you would like us to conduct? Please let us know and we will try to fulfill your wish. With that, I will ask Brother Noshad Qasam Ali to please read the dua, and after dua say few words about IC endowment plan that some of us may not be aware. The plan is mashallah, it started in 2019 and is going great. Brother Noshad, please.
Thank you, Brother Nusrat. Assalamu alaikum, everybody. I hope you are enjoying your lunch. And Brother Nusrat asked me to read a dua and talk a little bit about the endowment fund. So we will start the session with the dua. Bismillahir Rahmanir Rahim. And I will just read an excerpt. Brother Hadil, me with your permission. It's a dua from Dua Shifa when you read Namaz al-Tahajjud, the 11 rakat namaz. And the last 3 rakat, one is 2 Namaz al-Shifa, and the last one Namaz al-Witr. After Namaz al-Shifa, there is a dua to be read, and I will not read the whole dua, it's not very long. But the dua that really makes quite an impact on me, and I want to share that with you, is the last paragraph, and I read in Arabic and then I'll translate it. Allahumma inni ad'uka kama amarta, fastajib li kama wa'atta, innaka la tukhliful miyad. And its translation is, O Allah, I have supplicated to you as you have commanded me, as you have commanded me. And now you answer me as you have promised, because surely you do not break your promises. And to me, it makes a profound impact on what I ask Allah, because even if my dua is not fulfilled, I go back and take comfort in the sense that Allah knows what is best for me. So if He didn't grant me, but I still know He will not break His promise. So I just wanted to share that with you. And before the endowment fund, a couple of trivias that I wanted to share with you because it adds to our knowledge. Does anybody know what is the name of Surah number 55 in the Quran? Anybody? Surah Ar-Rahman. Surah Ar-Rahman is known for a repetitive verse in the Quran. Rabbi ayyi ala'i rabbikuma tukazziban. How many times has that verse been, is that mentioned in Surah Ar-Rahman? Anybody? Anybody? Guess? 70? 21? Your age, right? Anybody? 31 times. And I found that profound that Allah would take so much of the Quran capital and repeat that verse so many times. Because there's a reason for that you constantly need to remember and thank for all the blessings that Allah has given you. And none of it we are entitled to. So anything we get, it is a blessing and a mercy from Him. The other trivia, how many times is the word Quran mentioned in the Holy Quran? How many times is the word Quran mentioned in the Holy Quran? Anybody? Don't do your Google search. 70 times. 70 times. 70. Thank you. I have a whole list of these trivia. I can enjoy it to look at the statistics and how the Book of God has so many intriguing features in it that you can spend a lot of time. I want to talk just 2 minutes about endowment fund, and I know we're running late. The endowment fund, mashallah, is going very well for us. We have over $325,000 in marketable securities. We have almost $400,000 in life insurance policies. Now, these policies, some are whole life, some are term life. They will not be realized till the event happens. But it is encouraging that people are opening up and seeing the benefit of this endowment fund. And I will give you a recent example. This is just recently. We had someone who is, alhamdulillah, still alive and well, but the person decided that I want to leave one property to the endowment fund. And we've been working with the person, and we have just finalized the paperwork where the person has, upon the death, will transfer the property, and we have recorded that as a deed amendment, and the property will then be transferred upon death to the IEC endowment fund. And we are seeing people who are making monthly contributions as little as $100 a month. We are seeing people who have contributed as much as $100,000 in cash. We've opened an account at a brokerage firm, R.J. Raymond's, where we have one of our brothers here looking after the account. And alhamdulillah, it's going very well. I ask you from this platform to please think about it. 2 things. One, I hope everybody has a will in place. If you don't have, that's the first step to take, is to go ahead and get your will done. We can help you in that direction. These contributions that you make will be to IEC, and they're tax deductible. So there is an advantage of that as well. And as we all age, we need to look at how much do we need to leave behind for our families. There's always a surplus if you see it. This would be a great place to leave your inheritance, your legacy, and sawab jariyah for years and years to come. Thank you very much. Very important point. There is a charter that has been approved by the board where it is very clearly stated that the assets of the endowment fund will not be available for the day-to-day operations of IEC unless in dire emergency conditions. So we do not transfer any money from the endowment fund to the general fund for IEC. Alhamdulillah, IEC is now on a very good financial footing. Jijan, you had a question? Oh. Anything else, Brother Nusrat? I know we're running late. Sorry, Dr. Jafri. Please, yes, we thank the donor, and please read a salawat in the benefit of the donor. Muhammadin wa ali Muhammad salawat.
I just have a brief announcement. One brother just came and he said that he takes about 20 mu'mineen to Iraq for ziyarat every year. I have his address and contact, so if anybody would like to financially help him, please contact him. With that, I will ask Brother Hassan Ali Khan to come to the podium and introduce our speaker of today, Dr. Qamber Jafri, with a loud salawat.
Assalamu alaikum, everyone. Sorry we got a bit caught up in the things that happened. A couple of the main people who help out both were not available because of unforeseen circumstances. So we had to a little waiting for the, but of course we are waiting in a good place like IEC, so it still should be okay. Sorry again for that. Well, it's a pleasure to welcome Brother Qamber Jafri. He does not need any introduction to all of us as a person who is so committed and devoted towards the cause of the IEC activities and so on. But all the same, his professional knowledge is known to many of us, but there's a formal introduction that I like to make for him. He's a medical doctor by profession, And Dr. Jafri is board certified gastroenterologist and with over 3 decades of experience, and has a passion to educate the community on prevention, health and wellness. He will be addressing the important role of diet and lifestyle to cancer development, with emphasis on gastrointestinal cancer. Colon cancer screening will be part of the presentation. He has requested people to bring the family members. As I mentioned it to somebody earlier, it would be most effective for people who are younger to have set their lifestyle based on what they would hear from him. But even the senior people, of course, can benefit. With that brief introduction, I'd like to invite the Qamber Jafri with a loud salawat.
Assalamu alaikum. Thank you very much, Brother Hassan Khan and Brother Naushad. I really appreciate Al-Sadiq Forum for giving me this opportunity to educate the community. But I'll take a cue from Naushad Qasim Ali and maybe ask a few pre-test questions before I get to my presentation, just to see if everybody's awake here. So, ladies first, which is the most common cancer in men? Good. Okay. For the men, in the plate that are you eating right now, which part of that plate will give you more benefit? Look at the plate that you have, that you're eating. For the food that you're eating, salad. Good. So far, it's the 1-to-1. Huh? Which nation in the world has the highest rate of obesity? Which continent in the world has the most number of people with cancer? Which continent? All right, so I was just going to keep on going, and I thought maybe this audience really doesn't need this lecture, but since you didn't answer one question, I think I'll go through with about 40 minutes. So my objectives today is to understand the role of diet, role of lifestyle in cancer development, the good, the bad, and the ugly, dietary patterns and components that are good for your health and that can potentially be harmful to you. And then, of course, give practical steps to incorporate this, even if you're a medical professional, a lifestyle medicine in your practice, as well as us in the community, how to involve this. So, cancer is, throughout the world, the second most common reason for deaths. It doesn't take much difference between, say, heart disease and cancer. And if you look at the global cancer incidence, we have about 18.1 million new cancer cases every year. Asia being the most predominant, 40%. 1/5 are in the Americas and Europe. And then a lot of people unfortunately die very young in Africa, so maybe that's one of the reasons we don't see much. When you look at the gastrointestinal cancers, about roughly 26.6% incidence, and unfortunately about 30% mortality related to cancer, about 4.8 million in US, worldwide. And if you look at the burden, 26% of the global cancer burden, and 35% are all related to gastrointestinal cancers, with predominantly in Asia finding more esophageal, gastric, that is stomach or liver cancers, and colon and pancreatic cancers are more common in Europe and North America. By the way, let's keep it homely, so if I'm going too fast or any medical jargon, no problem raising a hand. So colorectal cancer, these are the incidences and mortality, and same thing with gastric, liver, esophageal, and pancreas. As you can see, although you don't have as much pancreatic cancer as incidence, but there's a high mortality because by the time you're diagnosed with pancreatic cancer, it's predominantly very late. Same thing with liver. So your answer was correct, prostate being number 1, and females, breast being number 1, but and then followed by lung and colon, lung being in both men and women, and colorectal again being 3rd. But when you look, these are the cases, but when you look at the mortality, there is a difference, with lung being the most common cancer for cancer death, both in men and women, predominantly related to smoking. Prostate being number 2, and breast being number 2 in females, and colorectal being 9. But if you see again, the pancreas has jumped up in as far as mortality is concerned because how late you get diagnosed. So in practical terms, what does it mean? Right in this room, I know there are cancer survivors, I'm a cancer survivor myself. So in general, you have a chance of 1 in 9 getting a prostate cancer, 1 in 15 of lung in your lifetime, colon and rectum of 1 in 23, 1 in 19 in men and 1 in 21 in women. So it is not, there is no gender bias in people having colon cancer. Many times, a lot of women tend to concentrate on their breast cancer screening, but they don't realize that they also die from colon cancer. We just had a Momina right in our own community die from colon cancer. So colon cancer is important even for women. 1 in 8 for breast, but when you look at lung, because of smoking in women, 1 in 17, colon rectum 1 in 25, and of course other reproductive organs, other cancers being low. Thankfully, your survival rates, when you look from 1970s to 2000, 2020s, we have been improving in quite a few cancers. But the importance of community awareness, if you can look at just this, when we started to have no smoking in restaurants and in different places, and a lot of awareness, and tobacco companies being pushed, you see the decrease in the lung cancer. Pretty much all the cancers have come down, except for pancreas and also liver and bile ducts. In both sexes, it's going down when you compare with the last 3 decades. So the question is how, while we are talking today, while we are just sitting here, a lot of our cells are being divided. We have millions of cells and they are getting divided. We all have a genetic predisposition for disease. It doesn't matter whether it is cancer or diabetes or heart disease. By the way, before I go for the next slide, is genes more important or your lifestyle and diet more important in cancer development? Anyway, there is Levi's answer your genes. Let's see. So one is saying lifestyle, one is saying gene. Let's see. So we all have genetic susceptibility, and then when you combine that with a diet that is tumorigenic, meaning it gives rise to inflammation. This is a typical question of colon cancer example. It leads to increased cell divisions, that is called hyperproliferation, and then it leads to a benign polyp, which is called an adenoma, and then with time it leads, and that process takes years. Okay, it's not happening overnight. So that's why I'd rather have more young people here than the senior citizen, but hopefully they will listen to it on live. So this is an example of colon cancer, but it is quite prevalent in other cancers too. In colon cancer, only about less than 15% is related to our genes, inherited risk factors. Okay, less than about 55% are related to a combination of your acquired risk factors, which is your diet and lifestyle. That means, at least for colon cancer, more than 30% is related to our diet and lifestyle. In other cancers, it's less, and we can look into that. This is a very interesting study that suggests why your diet and your lifestyle is important. This is based on Japanese immigrants that had moved from Japan after post-World War II and moved to United States, particularly California. And what you can see here is that in Japan, majority of the time they used to eat a lot of smoked fish. Whereas after moving to United States, they got their typical fast food diet. And what happened in the 2 generations, the risk, the incidence of stomach cancers went down in the same families, but the increase of colon cancer, suggesting that diet and environment have an important role to play in the development of cancer. 50% of your cancers are preventable. Some as high as 100%. So if you have a good program, you can do this. But see, breast cancer, nearly 30% can be prevented just by reducing your risk factors. Same thing with colon, 50% or more. And look at the top ranking risk factors. 19% can be decreased by just stopping your smoking, 80% by improving your diet, physical activity, and reducing obesity, and then radiation for skin cancers. So in general, your diet and lifestyle is a risky business, okay? Right from tobacco use to your diet, alcohol, and then we'll go through all of these in detail in the next few slides. We have all seen how in the last 4 decades, the epidemic of obesity. And somebody rightly pointed out, the United States is not just highest in war industry, but also in the obesity industry. Okay, their food industry has given rise to 35% of the population. Compare this to, say, Japan. So USA, Mexico, and even our friend Canada comes up down here. Here is a good, is BMI more important, or is your waist circumference more important? So BMI looks at your height and weight, but BMI cannot always predict. What has been shown is your abdominal obesity. Okay, so your waist circumference and your waist to hip ratio is more important than, your full BMI, which is based on your height and weight, because that leads to diabetes, that leads to high blood pressure, that leads to metabolic syndrome, fatty liver, so a lot, and of course, for different cancers. And this basically gives you how people have from about less than 10% where we were in 1990s, we are now about 35%, nearly 35%. Louisiana, for example, look at Louisiana, look at Texas, good 30% or more are obese. These are some of the cancers. For example, esophagus, there is a higher incidence of reflux disease because of obesity. That again leads to a condition called Barrett's esophagus, which again leads to adenocarcinoma or a type of a cancer in the esophagus. And also in the upper part of the stomach, breast cancer, thyroid, gallbladder, liver, multiple myeloma. So a lot of cancers are related to obesity. And these are some that have been convincing evidence that obesity is a risk factor. Postmenopausal breast, pancreas, kidney, uterine cancer, esophageal cancer, as well as colorectal, and with probable evidence for gallbladder, as well as those who have aggressive prostate cancer. Does exercise prevent cancer? Studies have shown yes. And these are 7 of the cancers that exercise has been shown to help: colon, breast, stomach, and uterine, esophageal, kidney, and uterine bladder. Your risk of dying prematurely declines as people become physically active. And if you can see here, your risk decreases at about 150 minutes per week, roughly. Okay? But any exercise is good. And this kind of gives us a MET score, which is basically your metabolic rate while you're doing exercise versus your basal metabolic rate. So if everybody's sitting here and watching me, you're at about a 1 MET, okay? But if you start running around the block here, you get up to 10. Okay, so you need about 1,000. Yes. So as I said, about 150 minutes. So it's either you do intensity. So even if you do 3 times a week, about anywhere from 30 to 50 minutes, so you roughly need about 100 to 150 minutes. And by exercise, what we mean is that if your heart rate is say 75, 80 normally, so by the time you go for a brisk walk and come back, it should be about 100. So you need to push it up to about 20. Okay, but any of these, exercise has been shown to help. And it's not just cancer. If you look at the benefits of it, it reduces your risk of dying prematurely, reduces the risk of dying from heart disease, stroke, diabetes, developing high blood pressure. And those who already have high blood pressure, if you exercise, you are much better controlled. Reduces your depression and anxiety. It will control your weight, helps build and maintain healthy bones, muscles, and joints, helps older adults become stronger and better able to move without falling. One of the main risks in elderly is falls. A lot of people die because their bone health is not good and they end up falling. Psychological well-being. Tobacco use, of course, is not just lungs. It is also your head and neck cancers, your larynx, some leukemias, kidney, uterine or cervix, endometrial, bladder cancer, colon, rectal, pancreas, stomach, liver, esophagus. And I hope there is no smokers here. I wish they were, but maybe they can listen. Both men and women, you lose about a decade of your life if you're a smoker. So typically they die about a decade earlier compared to a non-smoker with the same genes, same everything. Now coming to some of the screenings, breast cancer screening, at least the American Cancer Society says 45, at age 45, and then continue that yearly till 55. Some other societies start at 50 and continue at 55 and then kind of stop till about 75. So I-45 to I-75. Those who are smokers, many, I have seen, unfortunately, some of our own community members who are not getting this done, which is smokers who had a 30-pack year history. By 30-pack, that means either you're smoking 1 pack per day for 30 years or 2 packs for 15 years. They are entitled to get a screening done. We used to have no screening before. Now they can get a CAT scan done, and it should be done for people, you know, with that thing. So they have same thing for prostate. Little controversial when to do it, when to stop, whom to do it, but 50 plus, particularly you're African American, and if you have any family history, and there is a strong link of obesity and prostate cancer. Liver, one of the, by 2030, the number one reason in the United States to have a liver transplantation will be a condition called as non-alcoholic fatty liver disease. Non-alcoholic fatty liver disease is predominantly caused by people who have diabetes, who have high cholesterol like hyperlipidemias, who are obese, or who drink alcohol. Okay, so all of that stuff. So obesity is a risk factor for liver cancer. There are some countries that have aflatoxins. Of course, alcohol is the main thing. The good thing is coffee is protective for people who have underlying liver disease because it reduces fibrosis. You need about 3 cups of coffee a day to reduce your incidence of liver cancer. In esophageal, we talked about overweight and reflux, alcohol. Mate is a type of a drink that South Americans drink at a very, very hot level. Same thing in northern eastern Iran, they drink a lot of hot tea. So any hot drinks, if you're above 65 degrees centigrade, they have a chance of getting burns. There is some linkage of processed meat and drinking hot beverages. Decreased risk from consuming vegetables, fruit, and being physically active. Upper esophageal cancers are more common in people who are obese, who drink, and as we saw in Japanese, those who have a lot of salted fish. We tend also to put a lot of salt and put barbecue and kind of stuff, so that's not good. Some data on citrus fruit. Some evidence with processed meat, grilled and barbecued or smoked meat, and I'll talk about that later on. Low food intake. Pancreatic cancer. There's some debate in the sense that if you have a very high height, there's more cell division. So they have things for different cancers. And of course, weight, some evidence with red meat, processed meat, alcoholic drinks. Few case control studies have shown that eating fresh fruits and vegetables may decrease risk. Now, how do we screen for colon cancer? It can be through any of the colonoscopies that will give you the best picture, but then there are also non-invasive tests like stool test and blood tests that are coming up to screen. If you look at this, that's a normal small polyp. With time will grow into cancer. Typically 7 to 10 years, but a good, that is called as an adenoma carcinoma sequence. So in the same way that when you go to you look for a mortgage rate, if you go to a gastroenterologist, ask them what is their adenoma detection rate. Because if they are going to miss these polyps, then there's no point in getting that colonoscopy done. And that's a cancer that I recently had. So with colon, strong evidence, physical activity, whole grains, food containing fiber will decrease the risk, whereas processed meats are something like lunch meats, like your salami, bologna, A lot of our kids tend to eat a lot of that. The moms tend to give, it's easy to fix them a turkey salad type of a stuff, okay? So 60% of the diet that we eat in the United States is processed. But there are certain processed meats that are really harmful, same as cola beverages. And then some limited evidence of other fruits and vegetables and grains. So this gives you a same picture: diet high in red meats and processed meats, decreased activity, obesity, smoking, heavy alcohol use. Of course, age. You can have a vegan diet, but still will have cancer because your age is part of the cell division that is occurring. Type 2 diabetes and higher incidence in African American compared to the Caucasians. Same thing again in a different slide. What decreases risk and what increases risk. And these are some studies, what we call as meta-analysis. And what I want to focus here is that in Texas, on our weekends, we tend to do a lot of barbecuing. Okay? So when you barbecue your red meat, or any meat, you with your high flames, you end up producing these heterocyclic amines and N-nitroso compounds, and the higher fat content within that meat is going to lead to increased inflammation leading to those polyps leading to cancer. So there's a 12% increase in colon cancer just by higher red meat intake. So your beef, your chicken. So typically I would say, I think if I remember, it's like 17 grams or something. So once a month you're taking a biryani, nehari is okay, but not on a daily basis, not with every majlis or jashan that we do. Throughout Muharram, Safar, Ramzan, only thing we are doing is red meat. So that's a no-no from a health perspective. Alcohol, I don't have to address in this, August body, but 15% increase of colon cancer with just 2 drinks a day, which is considered as normal in the American population. So what they are considered normal is a man 2 drinks a day and a woman 1 drink a day. There is no discrimination among men and women, but metabolism by men and women is different. So women metabolize alcohol much faster, so a smaller drink level will give them more damage. And yes, yeah, definitely. But unfortunately, within even our own community, people do drink. When I've seen a lot of Muslims in my practice, and we do ask them smoking and alcohol, and they don't mind mentioning, because they're coming to us, that they do drink. So irrespective, but these are some of the mechanisms how alcohol damages your cell growth and then leading to cancer. So the more animal fat you drink, you have a higher relative risk of developing colon cancer compared to if you eat a lot of fruits and vegetables and whole grains. You can see how it decreases, starting at the same level. And this has been really done very well. These are colon cancer patients who have already had cancer. So the question is, once you have cancer, can you still change your diet and lifestyle and make a change in your outcomes? And what they have found is they gave these patients from Dana-Farber Cancer Center, they gave them what they call as a Prudent Diet, which is basically a Mediterranean diet, typically, okay, where they have more fruits and vegetables and grains compared to your typical Western diet. Out of the people that they came up with, only about 3% were able to follow strictly the diet for their whole period of study. But those who did follow, they found that their disease-free survival, if you look at how, if they continue with their Western diet, how they can have problems compared to those who ended up having a prudent diet. So, in conclusion, I'm really coming up, what are the pro-inflammatory diets? What are some of the things that leads to cancers? Low physical activity, high saturated fat, low fruit vegetables, more of the red meat and processed meats, smoking, increased alcohol intake, and being overweight or obese. Whereas those are anti-inflammatory are high intake of fruits, high intake of vegetables, omega-3 polysaturated fatty acids, whole grains, beans, peas, leafy grains, and either no alcohol or alcohol that is in moderate. We don't have to worry about this here, since we do a lot in our own religion. The role of intermittent fasting. Okay, there is a hadith of doing fasting every Monday and Thursday 1400 years ago, but now science is catching up and they are saying yes, it makes sense. So if you do about 14 to 16 hours fast and have only 8 hours time, what happens is it improves inflammation, which inflammation is the key word for every disease known to mankind. And also it helps in your gut microbiome. I don't have time to build into that. But it has been shown to improve obesity, insulin resistance, high cholesterol, hypertension, which is high blood pressure, and inflammation. So what's the good and what's the bad and the ugly coming up? So have a healthy diet, be physically active, eat plenty of fruits and vegetables, maintain healthy weight, and limit or not have animal products, and breastfeeding for women, because that decreases your chance of having breast cancer. The bad are the processed meats, red meats, excessive alcohol, smoking, obesity, sedentary lifestyle. The problem with this diet and lifestyle issue is that many of these diet studies, you cannot really follow them, as I showed you. Only very few people follow it. So that is largely subjective. Some issue with duration and sample size. Spirituality and health. Okay, since it is an Islamic center, let's look at that. About 1,200 studies collectively suggest that people who follow a spiritual path in their life, on average, live 17 to 13 years longer than those who do not, and they have a lower incidence of all major diseases. I guess that's why most of our ayatollahs above 85, 90, they go up to who knows what level. So spirituality does help. May have a relatively good health habits, including a wise diet and less smoking, and of course, alcohol consumption. We talked about that. Plus, something like this, Al-Sadiq Forum, rich social networks by virtue of belonging to a congregation of like-minded believers has been shown to improve your health. So what are these? Are the same thing: control weight, healthy eating, regular physical, breathing, and stress reduction. I don't have time for stress reduction, but there are some small studies. Connect with family and friends, appropriate, supplements. There's not much role. Yeah. Yes. Everybody should be attending Al-Sadiq Forum, even if they are not 55 and above. I wish there are a lot of young people here, but they are in the paintball, so I don't have any excuse. They do need the physical activity, so they're doing good. You can listen to the talk. Definitely. So laughter is good, okay? So stress reduction is good for your overall health. These are some of the challenges. I don't have to get into too much. That most of these studies are in high-income studies, and this is what I did today, and that's what we are doing. But we cannot change anything unless these patterns come up. Okay, if the food industry keeps on pushing for bad food on every, I mean, even the food that they consider as healthy is not healthy. Okay, that young lady who is in with Kellogg's, K thing that she does, that's not healthy. Cereal is full of nothing but sugar. Okay, so that's not healthy. So there is an incentive of the food industry to give you bad information. So it's for us to start doing these kinds of education things. If you don't change the environment, then IC can come up with saying no smoking, but if we do not enforce that, then people are continuing to go to smoke. So that kind of thing, So it's important that we as a community start taking health, as a challenge to have a systematic change. That's what I'm trying to say. Inform people about food and nutrition. I think I see the Laur Bhai. Yeah. So okay. So she's here. Haji's here. She can make it. No. She's on the way. Okay. So I wanted to have a dietitian here, so that if there are any questions for diet-related, discussions, she would have been here, but she had some other things. So need to do nutrition education and skills. You can modify a lot of your risk factors. Prevention is important. Again, public health related to a lot of things that we may not have control. Although the incidence of some cancers has decreased, the group of malignancy continues to pose major challenges to public health. Primary and secondary prevention are important by controlling for these, and an anti-inflammatory diet, reducing consumption of alcohol, exercise, obesity control, and screening when appropriate. And I would leave it with you. We do Hippocratic oath. Let food be thy medicine and medicine be thy food. We need to start prescribing people food. I take every opportunity when somebody comes for colon screening that we talk about food, talk about dietary changes. And Imam Ali had said, do not make your stomach the graveyard of animals. So let's make sure that when we do our milad for Imam Ali or any imam, or when we do madalises and stuff, we keep that in mind. And even if it is there, try not to make your own stomach the graveyard of animals. Yeah, thank you. Everything is related to team, and this is my team. My nurse practitioner helped me make a lot of slides. So thanks to Jessica for doing this. Thank you again. Al-Sadiq Forum will open up for questions. Thank you. Sure. Has improved. Yeah. So the question is on aspirin and gastrointestinal health. So the role of aspirin has recently changed. Okay, so unless you have had a prior heart attack, you're not advised to just take aspirin that we used to do before. Not recommended for everybody. Right, right. So because of that kind of thing. So, but if you have heart, issues and stuff. Yes. Yes, yes. By smoking, I mean tobacco in any form. So vaping is bad, hookah is bad, uh, chewing tobacco while playing baseball is bad. Any type of tobacco is bad. And I mean, in fact, a lot of pan that, you know, in India and Pakistan, we eat a lot of pan and chew, and they also have tobacco, but other things. That leads to a lot of tongue cancers and, you know, HEND cancers. Vaping. Gutka, yes, 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 leading to mouth cancers and tongue cancers and stuff. Go ahead. So it is locally. I will have to. We know for sure that if you're talking about Asians and Asian Americans, yeah. So our risk is the same as the normal American because we have changed our diets, except say all. And if you're a non-smoker, that's a different story. Okay. But as far as the intake of diet, we are taking the same type of meat that the others are doing. Okay? Maybe a little better for halal, I don't know. Oh, definitely. We have, yeah, as I said initially, 40% of cancers are in Asia. Because of aflatoxins, because of hepatitis B, because of hepatitis C, because of delayed in diagnosis. There is no culture of prevention in Southeast Asia, for example. I mean, nobody goes for colon cancer screening. I mean, you know, unless they get symptoms. You know, they still have this, you know, mental attitude that unless you're sick, you don't have to, you know, go. They even have a taboo of saying that they have cancer. I recently had educated family. She was diagnosed with pancreatic cancer. Till she died, she's only in her 60s. She's younger than me. Till she died, she didn't know she had pancreatic cancer because the husband and the family didn't want her to know. Because, you know, they thought she will die quicker. I don't know. I mean, I tried my best, but I couldn't convince them. So there are a lot of taboos in Southeast Asia. Good. Yeah. So for women, 35 and above is a risk factor. For men, 40 and above is a risk factor. Okay. Your BMI between 25 and 30 is overweight. 30 and above is obese. 35, you know, above is obesity number 1, and then you have obesity number 2, and then you have morbidly obese. But what they have found is that it's not just your whole. So your BMI is basically based on your height and weight. But what they have found is this is what you need to focus on. Abdominal obesity is a high risk for a lot of things. So and that is the most toughest to get rid of. You know, it's even people try everything. It's very difficult, you know, to do, but that has been shown. And also your waist to hip ratio. Oh, I'll have to look it up. But it's available. Yes. I'll have to look up for, I'm sure it does from a spiritual perspective. From a medical perspective, I don't know. The thing with medical knowledge and as doctors, unless it's evidence-based studies, okay? So what we'll have to do is, for example, Israel has done a lot of studies on Muslims there during Ramadan. Has been shown a lot of things have helped. Okay, so you will have to do a study where you have 20 people who only eat halal and 20 people who don't eat halal, and then check them with time. Okay, but does it make sense? I'm sure it does, because the way we, the blood is taken out and stuff, I'm sure there are properties that help. Good question. Yeah, so if you're looking for cardiovascular risk, it's different versus if you're looking, say, for cancer and stuff. Any exercise is good because when you push somebody and say you do have to do da, then they just run away. That's the only, that's good to run away, but exercise. But still, you know what I'm saying. Yes, Salisa. Yes. 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 Absolutely. Absolutely. Yes. Plastic is a big thing. Yes. I agree. Yeah. Yeah. Yes. N- I agree with you 200%. I even bought cups for a while. There are some who still do, okay, but it is very hard to implement. There are some smaller centers I know that have done, okay, but the logistics of it is challenging for large centers. So what you would need is a whole change, and it starts, I'm sure the leadership is there, but the thing is, unless you have volunteers, you know, they don't even pick up their own plates, forget, so I'm sorry to say. They pick up, you know, so they think it's the volunteer's job to pick up the plates. So, but you bring a great point. Plastics have been shown to lead to cancer. Yes. Yeah, yeah. And ideally avoiding microwave is good also in general. See. Yeah, there's a question at the back. Your brother. Yeah, go ahead. Yeah, so that, yeah, right. I mean, that is a full different topic, okay? But I can give you a 30-second thing. Yeah, predominantly is related to diet, okay? No idea. Non-BP, I think it's a diet, is it Haji there? No, it's a dietitian question. I can she's not here. I don't know. Non-BPA question. I don't know. So gas is. I mean, gas is normally produced. Okay. I'll just give you good trivia. Okay, a plane that flies throughout U.S. for 1 year. One plane that flies throughout U.S. for 1 year. How many times do people pass gas? Latest. Throw me a number. Few thousands, more thousands. What is it? A million? Oh, you're saying a million. It's not that bad. 185,000. Okay? So when you're going a higher, I'm sure the live is over, right? Yeah. Oh, live is still on. Oh, shoot. But I mean, I've done this in radio shows, so it doesn't matter. So, so there are a lot of mechanics for gas production. Okay, number one is your diet. Number two, it is a type of diet. Certain good foods will give you more gas formation. Okay, that's the nature of that diet. If you're going to eat a lot of dal, for example, legumes, it's going to give you gas. Okay, so a lot of foods that we eat, which is Mediterranean diet, does give you, but with time you improve on that. Then there are certain disorders of carbohydrate metabolism, like milk intolerance, fructose, galactose. So there are a lot of sucrose, which leads to more production of having problems with gas formation. And then some people might have bacterial overgrowth syndrome, which is quite often happens when people do a lot of antibiotics. So if you take a lot of antibiotics, you change your bacterial flora, so then the good bacteria are kind of gone, and then there's an overgrowth of the other bacteria leading to gas formation. So it is a bit complicated, to explain. But yes, last question maybe? This time, okay. Sure. Yeah. Alaikum salam. You can ask in Urdu. I'll do my jawab in Hyderabadi Urdu. जी. Right. Yes. Yes, yes, that's good. Yeah, 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 yeah. Yes, I showed you on the thing, okay, intermittent fasting, which is 16 hours of fast. Okay, 14 to 16 hours of fast. That's fine. People have done 36 hours of fasting or more. Okay, so it can be done. जी जी या बिल्कुल प्लस आपके पास स्पिरिचुअलिटी है या सही है नहीं सही है सही या intermittent fasting helps, spirituality helps, and stress reduction helps. Oh. Yeah, you're a model. Thank you very much. Leave it with Brother Hassan Ali Khan.
Thank you very much. There's a lot to learn from what you said and a lot to practice as well. Even when we are old, we can do that. Thank you once again. Inshallah, we'll count on you.
And
we'll
for Irfan Mirza,